Well, I think looks like we have a lot in here, so we're gonna go ahead and get started. I tried to write down as many of the organization I was seeing, and just so that we can kind of save time. I'm going to ask each organization, one person that represents the organization, to kind of say their organization and who's all on the call. So everyone decide who that is, and I'm going to start with Cornerstones of Care.
Yeah, hi, Justin Horton, Chief Programs Innovation Officer at Cornerstones of Care. I think I'm our only attendee because our other folks attended yesterday. So.
All right. Stepping Stones.
This is Lynn Durbin, and hello, we have
Hello.
Carol Waymeyer and Carrie Ellis on, I believe.
Yes, I'm here.
All right. Foster Adopt Connect.
Hi, I'm Meredith Greenfield, Director of PQI, and we have Jennifer Johnson, our COO, and then two from my team, the PQI team, Marina and Heather, and then another from our behavioral interventionist program, Karen. So thank you for having us.
Good deal. Restart.
Hi, Jessica Brown here. I'm the Director of Adult and Clinical Services here at Restart. And on the call, we have Jonathan Roberts, our COO, and also Rochelle Smith, our Clinical Services Program Manager.
All right, another Rochelle. Maddie Rhodes.
My name's Alicia Gambino, and I'm the Research and Program Evaluation Specialist at Maddie Rhodes Center. I don't know if she's on yet, but Monica Mayberry, our Director of Community Behavioral Health, should be on call.
All right, thank you. Rediscover.
Hi, I'm Will Walser. I'm the Quality Improvement Manager here at Rediscover, and I think also on is Leah Velasquez, our Director of Quality and Compliance.
All right, U of H, University Health.
I am Tara Knutson, the Director of Quality Improvement, and I know Jennifer Keller, one of our Senior Directors, is on as well. And I think eventually Sharon Frazee is going to try to drop on if she's able to, who is our COO.
All right. Burrell or Burrell?
We pronounce it Burrell, like squirrel.
All right.
Hi, I'm Matt Underwood. I'm the Assistant Director of Quality Improvement and Research, and I think we have Savannah Youngmeyer here with us as well, who is a Quality Performance Specialist.
All right, and the Children's Place.
Hi, everybody. This is Ann Thomas, and I am the CEO of the Children's Place, and the rest of my team was on yesterday.
All right. Did I miss anybody in the organization?
This is Amanda Davis with Crittenton.
All right, Crittenton.
I think I'm the only one on because everybody else is on PTO for this week. So last man standing.
All right, well, the great thing is we'll have a video for you and they will be able to sit and watch the video. Thanks, Taryn, for always being able to convert those over to YouTube. And so we're going to go ahead and get started. And so next slide, please. So what we're going to do today is just briefly go over some important dates, a review of terms, the form, the goal and KPI form, and the KPI dashboard. And we're going to go through some examples. Has everyone got the instruction manual that we sent out? If you have not received that instruction manual, put that in the chat also so that we can try to get that to you. Oh, got Rose Brooks on. Next slide. And so here are some important dates that we have. March 31st, which is tomorrow, is coming up for the proposed set of goal and KPI forms and the KPI dashboard. We know that everyone may not be able to get those in. But so we will continue to work with you, even if you're not able to get those proposed sets. But also, if you do have ideas, you can put that on there, because later on, Susan and I will be meeting with each of you to kind of go through those and finalize them. And as you see, April 30th is when the final goal and KPI forms are going to be approved. And so after that date, we can't be substituted. So we most definitely be working through the month of April of getting everyone where they need to be and getting those goals finalized and the forms approved. We have reporting dates of 7/31, 10/31, and 1/31/24. And as you see, those are dates around when you have to do your billing. So we're trying to keep everything consistent so that when you're doing one thing, you can be doing the other. Part 2 of the instructions for reporting and filing tasks will be provided, and we'll talk a little bit about that at the end. And as you see, March, April of 2024 will be when that performance payment will be announced and paid to agencies. Next slide. And so just a review of terms, you know our domains, which is on that goal and KPI sheet. And these are our area of interest for our Community Mental Health Board. But during this time that we've been doing value-based, we've been seeing that it's also an interest of you, of all the agencies. Every agency has touched 2 or 3 of these as we've been doing discussions. And so we have access to care, which of course is how people get in, how timely they get in, availability, outcomes, clinical or functional. And this is how people are doing, what we're seeing from assessments, what we're seeing from any functional things that our participants could be getting from their services. The client experience or satisfaction. Some of the times this will come from surveys and staff experience and satisfaction. And this could be around recruitment. It could be around engagement. It could be around burnout. And so we'll go through a few of those. Goal, desired resort of your agency and program is trying to achieve. And one thing that we always talk about here at VBP and the Community Mental Health Fund is that we want you guys to identify those goals that are important to you and that you want to achieve. And that's the difference between our VBP program and other VBP programs, is that we're not identifying what you need to improve on. And then the key performance indicators, which are variables of what you want to do to measure the performance in that goal. And of course, the rules define the structure and steps. And what we have done is try to keep this as fair and equitable as possible. We know that all of you guys are individual agencies, and we have different ranges of funds that you all guys request. So we wanted to make sure we kept this as fair and equitable as possible. Next slide. Do we have any questions about the dates or anything like that so far? All right, so here's part 1. And so step 1 is going to always be submitting the goal and the KPI forms. And if you receive the instruction packet, this is how the goal and KPI form looks. Each organization or agency must submit 1 minimum goal, but up to 4 goals with KPIs, and a maximum of 12 distinct KPIs across all goals combined. And so in other words, 1 goal, as you see on here, could have 4 KPIs to it. We don't expect everyone to do 4 goals out the box. We do kind of think an average is going to be 2 goals with 6 to 8 KPIs. And that's most definitely going to get you an opportunity to get incentive payment. And so next slide. And so what we have here in an agency example, and our agency is ABC Mental Health Clinic. And what we also want to really stress is this is not a directive. This is not something that we're saying you should be doing. These are all examples that we're going to be given today just to invoke some thought and conversation with you guys, but also just to show you the process of how you're going to how you will develop a goal and how those KPIs will be developed with it. And so this is not an attempt to say this is what we want you to look at, but just an example. And so goal 1, attempt to increase the number of clients whose depression is reduced from severe to moderate or less by the X session. And so this is something that you will monitor, and you'll have several different KPIs with it. And so we're going to show you how we're going to build on that. Next slide. And so as you see here, it says goal, and you would put number 1. Excuse me. And we will want you to stick with that goal being number 1 throughout the process because of how we're going to be gathering this information. And you'll see on your dashboard that it'll have goal number 1, and you always want to make sure that whatever you assign that goal in the beginning is what you keep it. And so reduce level of depression of clients with intake screening of the severe depression to moderate or below. And so let's first talk about that. If you were to look at all the participants that you have in a particular service, your numbers are not gonna, you're not gonna change your data that much because you're gonna have some people coming in at the low end, you're gonna have some people coming in at the high end, and they're probably gonna average out. And so that's why we're thinking it's better to have a subset of your population. And of course, this is on depression. It could be on any assessment that you have around anxiety, around PTSD symptoms, around resiliency. It's whatever assessment that your agency is using that you want to find out more information on. And then also by the X session. And so we're putting a measuring stick to that because you want to look at everyone consistently and with reliability. And so if you were to pick 6 sessions, it would go for the person who has sessions weekly to the person who has a session every month. You would always just pick that 6th session, and that just keeps that reliability, and then that also that's consistency in how you're measuring your goal. Do we have any questions about that?
I have a quick question.
Yes.
Rochelle.
Hello,
So-
Kappa, Christina.
Hi. So I heard you mention that we could pick a subset of the overall population. Will you say
Yes.
more about that?
So there's different subsets. So let's say if we're doing the PHQ, you might want to check a certain level who are coming in at that severe and then changing to moderate, because if you look at everyone, your numbers wouldn't change. But you could also look at a subset of 19 to 25-year-olds. You could look at a subset of just people who are diagnosed with a certain diagnosis, and your agency is getting a lot of those people in, and you want to try to find out, are you really doing, are you helping them? Are you having improvement with them? And so a subset could be anything that you see that is maybe prevalent within your organization, or you just want to find out if you are really doing everything you need to do for that set of people.
Okay, thank you so much. That was helpful.
All right, next slide. And so now we have the principal KPI, and your principal KPI is really going to be a reflection of your goal statement. And so as you see, it's percentage of clients completing 6 sessions in this reporting period whose intake score was severe depression and now score moderate or below. And so you see the reflection of that KPI, your principal KPI, what you're really going to be focusing on changing inside of that goal. And you see it's also a part of the outcome domain, because that you're looking at what's the outcome of that participant. You can also use, I'm going too far ahead, but so that's the outcome. You see the KPI short name, depression improvement at 6th session. That will be used on your dashboard so that you don't have to type out your whole KPI again. And so that also we will need for that to stay constant. So whatever you name that for the short name, that's also what you will put on your dashboard. And we'll be going over the dashboard a little later in this presentation. Do you have any questions about primary KPIs and how they reflect the goal? All right, next slide. So here we have some additional KPIs, and they just really support how you're focusing on the principle and how you're also going to be performing within that goal. And so you see the second one is number of days between date of intake and X therapy session. And as you see that looks at the access domain. So number one, you're going to see that you don't have to have a goal and all be the same domain, because we know that access is going to also have a dependency on the outcome. And then the next one is percent budgeted FTEs, therapist positions vacant in the reporting period. And as you see, that's coming from the staff domain. And so we also know that how many FTEs you have is going to be dependent on your access, which is going to be dependent on your outcomes. And so you're seeing how all these things are interdependent of each other. And you want to watch these because some of the time you fix one thing and you mess up another. So that's just showing you how all this goal can be in all of these different domains. And so if you wanted to have percent budgeted FTE positions filled, if you wanted to say we have, because you would look at, here's how many FTEs we're supposed to have. We're supposed to have 8, but we only have 4. You could look at it half full or half empty, whichever one you want to. Do we have any questions about that? A few other things that you could look at is the caseload, average sessions per client. You could look at unique served. You could look at the average caseload of your therapist to give you information on how you're going to be getting to reducing the level of whichever assessment you're going to be using. Next slide. And so here you have at the end that are just kind of modifiers. And so total KPIs is 3, and some of the other sessions that we have done, we have said that 3 or more KPIs with a goal is robust. So of course you would get more points for how many more KPIs you have with this. And as you see, you could have 4 KPIs if you wanted to with one goal, but that just increases your points able to earn. And then total domains, which also is a modifier, and it can also increase your points because now you're working out of 3 domains instead of just 1 domain. And so do we have any questions about this or any discussion that anyone wants to have? All right, well, we will go on to the next slide and the next goal. And Susan is going to be talking to you about an example in the access domain.
Yes, thank you very much, Rochelle. So in this example, same agency, as Rochelle said, is going to focus on access. And their goal is that for individual therapy clients, they'd like to see the time between intake and the individual's first therapy session to reduce. They want that time to be shorter. And the agency is going to monitor several KPIs in addition to the principal, which, as Rochelle described, is defined to really capture what you need to measure to look at that intended goal. And then in this example, we're also going to show you how a KPI is going to be used in both of these goals. Next slide. So here we have labeled goal number 2, and it's stated as that for clients seeking individual therapy, reduce the number of days between intake and the first therapy session. Next slide. And then here we get down to the specificity of what we're actually going to measure in relation to that goal. So in this example, again, the short name, we're going to call this days until first session. That's just a quick identifier for you and for us when looking at data on the dashboard. And the descriptor is of the clients seen for the first time in this reporting period, the percent of clients whose first session is X number of days or less from the date of intake. Same principle applies here in terms of the more specific, the more meaningful the data will be. So if, for example, we took an average number of days between intake and the first session, you know very well, given the likelihood that some, for whatever reason, might have that first session in 3 or 5 days. Others, it might be 20 days or 36 days. So averaging all that with those outliers is going to yield much less meaningful data to evaluate that movement towards your goal. And in this example, as in Rochelle's on outcome, that number of days might be set on your current policy or target, or some other funder's mandate of when that should occur. And then it could simply just be a conversation in order with your team to draw a line in the sand and say what feels good, what feels like it would be meaningful and acceptable to us as a program and a provider and to the client. So you draw that line, and then based on what your data looks like, you're going to evaluate and perhaps change that. So the census is related to the how quickly folks are getting into care, getting engaged. The domain is access. And next slide. So moving on to the additional KPIs. So in comparison, the additional or supporting KPIs support or influence, or you think may affect that primary goal and the primary thing that you're measuring in your principal KPI. So the first one that they're looking at is unique clients served. That's the short name. And that's defined as the number of unique clients who were seen at least one time during the reporting period. Now we're talking about how many individuals are being seen. And again, that relates to the access. The intention here is to get a pulse on how many clients are being served over the period of time to determine perhaps whether or not decreasing that time from intake to the first session may result in more or less clients being seen. And the data that you start collecting and seeing and analyzing is going to help tease that out. So the next supporting or additional KPI is the one that is being used twice in both of these goals. And that's looking at vacant therapist positions, defined as the percent of total budgeted FTE therapist positions that are currently vacant. So for goals that are related, and in this one, we're talking about access for individual therapy, and in the goal number 1, outcomes for individual therapy. Using this indicator for the 2 goals is an efficient way to look at and capture more meaningful data. So in the examples, we're hoping to see the degree to which program is staffed may influence not only the timeliness of clients getting into service, which is this goal, but also how it impacts perhaps clients achieving their actual desired clinical outcomes. Since this is directly related to staff, it falls under the staff domain. And then finally, the third supporting KPI captures how satisfied clients are with the length of time to begin therapy, which is the short name, client satisfaction with access. And that's defined as the percent of therapy clients who respond very satisfied with their access to therapy. So again, the specificity here and how the indicator is defined is going to yield much more meaningful data. Now, the percent, for example, if you are only counting very satisfied versus satisfied and satisfied, very satisfied, you may yield a much lower percent, or maybe not much, but let's say it's, if you're counting both, your percentage is going to be higher. It may be 75%. If you weed that down to very satisfied, which gives you a clear identification that those folks felt really good about this, that percentage is going to be smaller, most likely, because it's a more targeted, a more specific response. And we want to make sure that there's an understanding that there's no penalty for that, just because that might be a smaller percentage. What you're really interested in and what we're excited to see is the change that happens with that particular indicator in relation to the goal. And then the additional piece of specificity here is we're not just asking satisfied with therapy, but specifically very satisfied to access, to how quickly they got into therapy. Questions on those indicators? Okay, good. Next slide. So as in the previous example, we're going to tally up the number of KPIs that this goal reflects, which is 4. Even though one of them was reflected in the other goal, it's still representing a KPI in this one. And then the total number of domains represented would be 3. You're looking at access, staff, and client. Next slide. So once you've completed your goal and KPI,
Susan, I don't know if there were any questions on that, and I wanted to make a comment on the previous.
Oh, okay.
Slide, if you
Please.
may. But we might ask if there's any questions. The idea here that Susan just made, that the number being lower is not a penalty, is a hugely important point in quality improvement. In a real sense, we're not really paying attention to the absolute number of that, because we're not setting a line in the sand and saying we don't want it to be this. It really is a helpful process for the process improvement, because instead of looking at the entire population, it acts to select what we call the outliers from whatever line in the sand we've drawn. And those outliers can be a lot easier to analyze and can give us much better hints than if we're looking for something in a big pot of soup where it has all of the clients that actually met the requirements quite well. I remember even telling some teams that had particularly bad access at the beginning, and they measured these percentages and they couldn't even get people in 20 or 30 days. And when you can start by saying, look, we want to get them in 15 days. And even if your standard is lower than that, what it does is it sets an initial project to clean out those outliers that are above 15. And after you satisfy that goal and maybe make progress with that, then you set a new goal for the next year and you bring it down to 5 and so forth. So that number is completely arbitrary, as Susan and Rochelle have said, and really serves to narrow what we're looking at when we're doing analysis and helping resolve it.
And that goes directly to your question, Christina, on why you would have a subgroup.
All right, very good. Any other questions? Okay, next slide, Taryn. So now we're looking at step 2, which is completing your KPI dashboard. And the dashboard summarizes all of the unique KPIs across your goals. And again, you can have up to a maximum of 12, noting that a KPI can be used in more than one goal, as you've seen in the examples, but it can only be used as the primary KPI in a single goal. So an important piece of the dashboard is, and the reason why we need to have it, is that it's key in managing data as it assigns a unique ID to each KPI, and that ensures that the correct identification is used in all of the subsequent reporting, because these IDs will remain consistent through the year. So you see here the list of numbers, the IDs on the left, and then your agency name, the KPI short name, short here, so you don't have to type out the whole thing like Rochelle said, and then the goals that are associated with those respective KPIs in the associated domains. And again, emphasizing a maximum of 12. It's hard for many to not put 12 when there's space for 12, but it's not a requirement. The only key minimum is the reporting, the declaring of one goal with up to 4 KPIs. Next slide. So here's an example of the goal and KPI form from the initial outcomes example with the completed dashboard. So you see that the principal KPI and supportings have been numbered 1, 2, 3, and you can see those lining up in the dashboard. And next slide. And then here we have 3 additional KPIs associated with the second goal, seeing number 3 highlighted because it's already in your dashboard because you've listed it. And then if you look in that goal associated with KPI column, there's the distinction for KPI number 3, vacant therapist positions, noting that it is both in goal 1 and goal 2. Any questions on that dashboard? All right, next slide. So you might be wondering why the limitation and the restriction, the limiting on the number of total goals and KPIs. That's really to ensure focus on quality versus quantity and incentivizing those targeted goals that are really meaningful to you and that you feel would have the most meaningful impact to those that you're serving in your program. So just to recap again, in order to participate in the value-based payment process, you need to declare at least one and up to 4 goals with associated KPIs, and a maximum number of 12 unique indicators across those goals. And again, it's important to pause here because 2 solid goals with maybe 6 to 8 PIs really is going to yield a good opportunity for a meaningful value-based payment. There's lots of variables in there, but particularly starting out with the process, that will afford really good, solid, and meaningful work to delve into some areas that you're really, really interested in. And next slide. So Teresa is going to add in here for just a minute, but I want to reflect on many of you participated in sessions where we talked about tasks and how tasks would be given point values, and that would in turn determine the actual payment. What we wanted to do in splitting up the rollout of these instructions is to, first of all, really focus initially on these goals and KPIs, because they are really the foundation of the quality improvement work in the value-based process. And yes, we talked about tasks, and the value-based payments will be determined by the number of points assigned to those tasks. And then that gets converted through a formula to your value-based payment. And I want Teresa to elaborate on that just a little bit.
Thank you, Susan. I turned off my camera because I've got 2 screens going and it's confusing me. So thank you for that.
It's okay.
So thanks, Susan. And just to reiterate a little bit, yes, there are several components of this value-based payment process. And because we want to ensure success and minimize confusion, that's why we're rolling out each component separately. And today, the component that you've heard so far is about the goal and KPI instructions. And Susan already said this, which is the foundation of quality improvement that your agency will continue to build upon. So after you've completed this step, Part 2 will be the reporting of the tasks, and those tasks are associated with measuring your progress toward your goals and KPIs. And this is where you will start to earn the points. The tasks are categorized into 3 areas, and those are reporting, analyzing, and improving tasks. And then Part 2 of this will be the rollout of the instructions for that reporting, or for those reporting and analyzing tasks. Those instructions will come shortly after you've been approved for your goal and KPI statement. And it's intended then to help you prepare for the first reporting date that's in July. Again, we understand this seems like a lot of work and it's complex, but keep in mind your liaisons are going to be working with you in this month of April to really establish some solid goals and KPIs that are really aligned with the information you're already collecting. And that's one value of the board is we don't, want people to have to make large investments in collecting new information and all of those types of things. And it's also not likely that agencies will get to an improving type task until later on in the year. So the reporting and analyzing tasks are really to position you for later on to get to those improving tasks. Part 3 of the rollout will be the instructions for those improving tasks. Now in Part 2, as we've talked about, the earning of the points, you'll be able to earn those every reporting period. And the value of those points that are associated with each of those tasks, you'll get that in Part 2, the second rollout, so that it's very transparent. Everybody will be aware of how many points are equated with what types of activities and different things like that. The point values are allocated based on the complexity and the difficulty of the task. You'll get a big spreadsheet, and it'll also be on our website and stuff, so that you'll have all of that kind of detailed information and have an opportunity to ask questions and talk about that. Let's see. At the end of the year, when all reporting periods are complete, the total points earned are then used in the formula to calculate your performance incentive payment. And again, while this seems very complex, it is. It's taken a lot of time to get to where we're at right now, and we're so grateful that each of you has stuck by this. We've learned a lot from this process. We're learning with you. So we're really, really excited to be at this point. And I can tell you all, this is a really, really progressive endeavor in making payments and investing in our mental health structure. And because it's so complex, the board and staff, we've taken a lot of time to ensure that this VBP process was operationalized in a way that is equitable for all of the agencies. And I hope you've heard this enough and can trust that we want to position our network of agencies to be successful in this process, and ultimately to improve the mental health care that is available to the uninsured residents in Jackson County. So that's the ultimate goal of all of this. So that's just kind of a briefing of what's to come next and the point structure, and I'm happy to answer any questions about that payment process or anything I could talk about.
Okay, thank you very much, Teresa. I want to add on to that, sometimes when we hear how complex something it is we might tend to think, oh, wow, what have I gotten myself into? So I want to make a distinction in terms of the complexity that Teresa is talking about. There is a very high degree of complexity that goes into creating a fair and reliable formula to assigning point values to tasks and the formula to determine payment, because we're looking at a provider community with a huge range in what your base allocations are. And so assuring that how the payments are distributed and based fairly on reliable and tested and fair methods of calculating is the primary part of that complexity. The tasks that Teresa is talking about, and you saw in prior sessions, most of you, those tasks are things that most of you are really, really familiar with, like the reporting tasks is reporting your data. You've been doing that. Analyzing tasks, those are using that data to establish baselines and target improvements. And that's why Teresa's saying improvement, actually seeing that improvement is going to come later, because you've got to set the foundation. What we've talked about here today, the establishing the goals and the appropriate and specific KPIs. You know that best because you know your organizations. And then using the data that you're collecting to figure out where you need to go to improve. Where are we now? And what target do we need to shoot for that level of improvement? And there is even complexity around how do we establish what is an appropriate goal or target. And that is meant, that piece of the complexity of this project is, again, meant to assure that Everybody's calculating baselines in the same manner. Everybody's looking at data in the same manner. And that's to ensure that there's going to be fairness in the system, regardless of how big an agency is, how robust their quality improvement team is. Everybody's going to be working from the exact same playbook and just focusing on, we've referenced the playing the game. Same rules, same playbook, but you all get to choose all your pieces.
Yeah, that's a good analogy, Susan. It ensures some consistency.
Absolutely.
That will definitely help in measuring and calculating.
Yeah.
Everything.
So next steps. Taryn, next slide. So we're going to send out the recording for today's session. And with that, we will send the workbook and the instructions that were emailed prior, just to make sure that everybody's on this call actually has that information. And this, the instruction booklet that you received was more complex and detailed because it was intended to be read. This was much more simplified because we wanted to talk you through the examples and present rather than read to you or have you read it. So yes, there's been a number of comments that this looks different. Can we, so yes, we're going to give that to you. Now, again, tomorrow is March 31st, and we recognize that we had these two sessions so close to the 31st, but we've been talking about it. You have those ideas. If you can't get them in or not comfortable getting them in by tomorrow, as soon as you can, certainly the better, because as soon as Rochelle and I receive your proposed goals and KPIs, then we can really start doing the work together to modify them if need be and talk through that all through the month of April, with April 30th being the target for the actual approval of those goals and KPIs. So when you're ready, and as soon as you can, email those to either Rochelle or myself, whomever is your respective liaison. And we said in the instructions and want to emphasize here that the consistent labeling of the workbook is important so we can make sure that we're keeping your data with your organization. So your agency name followed by 2023 VBPWB, that's a mouthful, value-based payment workbook is what that means. And when you send that in to us, if you could provide 2 to 3 dates during the month of April for your team to be available so we can set some time to review that, then we certainly, that'll give us a heads up and be able to schedule those sooner. In the meantime, as you're working through this, any questions at all, you can touch base with anybody on the team, but certainly Rochelle and I. And with that, and if anyone thinks I'm forgetting anything, remind me. And
next. So your meetings may not start till afterwards. I don't know if you're planning on doing anything next week with your training.
I will be, yeah, well, Rochelle is not. I will be in training next week, Monday through Thursday, but I will certainly have opportunity if I'm going to be as responsive as I can, as quickly as I can to anyone who is sending those in tomorrow and into next week. So that's my time frame might be limited, but I'm not going to be unavailable for the week. In other words, if that makes sense.
Right. Yeah. Okay. That sounds good.
Yeah. So we have 9 minutes remaining. If there's any comments or questions, all this probably needs to download a little bit, and questions may be forthcoming, and that's totally fine.
I'm ready, so start shooting them to us.
Yep, we're anxious.
We're ready.
About getting ready to do this.
I've already got a couple and I'll be emailing you here in the next hour.
And if anything that you've done so far and that you're thinking about, all those feelings that come up that are like, ours doesn't look like that. That's why we're here today. And that's why we're available to you all through the month of April to really flush those out and get them ready to go so that you have a really good foundation to start for this year.
Yeah, absolutely. That's why they're drafts. Have time to massage them.
Yep. Okay, well, thank you all very much. Shoot us a message if you have any questions, and we'll get that information to you. And if our team, the funds team, can hang on just for a minute to debrief.